Welcome to the first pitch interview of the GIC 2017 conference in Austria. We're sitting here in the beautiful garden of the hotel in Hirschwang, and we're going to have a conversation about scientific research about breathwork. And the person I'm going to talk with is Philippa Wheble.
Wheble.
Ah! Yeah, these are the scenes you always, you get.
My name is Dr Philippa Wheble.
And my name is Dr Philippa Wheble. Okay.
And breathe.
Philippa Wheble is a UK-based GP, and in addition to her medical training, she is doing a Master of Science at the University College in London.
Yes, very good.
And she's doing research around breathwork and fear disorders of musicians. And we're going to talk about your background, what triggered your interest in the subject, how you're approaching the research, and a lot of things I'm very curious about.
Perfect.
So why don't we start out with why you became interested in this specific question and what you wanted to find out.
Okay. So I'm a medical doctor. I've been a musician my whole life. I sing and I play the violin and the viola and the piano, and I have always had a real interest in performance and medicine for musicians, if you like. And about 6.5 years ago, I was working as a doctor. I was working full-time, and I became very stressed and really was struggling, and I went to see somebody to talk about that, and I found breathwork. And I was very moved by how connecting my breath and really feeling my feelings and experiencing where I was and how I was could help me to move through this very difficult time in my life. It's been really powerful in terms of my clinical practice, being able to finish one conversation and one consultation and be able to really bring myself back into the present moment to be prepared and open and ready for the next patient. And it has really changed my awareness of particularly anxiety and fear within my body. Anxiety and fear, they really serve us up until a point. So it gives you adrenaline, and the adrenaline makes your heart rate go up a little, and it sends all the blood to your big muscles. So if I was an athlete, if I was a sprinter, that would serve me really well because I'd be ready to run. That's the fight and flight response. It's the same as running away from a tiger. But when you're a musician or a singer in particular, you are reliant on fine motor skills. So your hands, your lips, the control of your facial muscles for the trumpet. The vocal folds are controlled by a series of very, very fine muscles. Now, when you're running away from a tiger, you don't really need to shout. You don't need your voice, and you don't need to be able to do dexterous movements. You need to be able to run really fast and pull yourself up a tree. So when you get an adrenaline response, these processes that happen in your body to physically prepare you for a fight, they don't serve you technically as a musician. So there's a very, very fine point where you're anxious enough that you're alert and there's a tiny bit of danger, and that helps you to move through and really give a beautiful, passionate performance. and just tipping over the edge of that curve and suddenly being in fear and paralysis and stumbling on a note or something not sounding, or opening, as happened to me, opening your mouth to sing and no sound coming out because the muscles are tight. So never more so than in singers this is relevant, because their instrument is inside their body. It's inside this hot pot of stress. And their voice is the voice of a professional singer, is their entire identity. That's who they are, as well as what they do. And it's precious and it has to be protected. And the more anxious that you get, the harder it is to take a breath and control the airflow, because in anxiety we breathe fast and shallow. So breathing fast and shallow doesn't really serve your diaphragm. And then, so you breathe fast and shallow and your carbon dioxide level gets a little bit low, and you know, your fingers start to tingle and maybe your lips tingle and your mouth goes dry, and suddenly you're taking a breath in. You're walking on stage, taking a breath in, and all the muscles tighten up to try and hold it together. And all it takes is one experience of your instrument not working right for this to connect in a cycle. Fear, tension, failure, fear.
What a beautiful vicious cycle.
Right?
So you brought with your experiences from breathwork to the academic arena,
Yes.
to the University College in London,
Yes.
the idea to write the master thesis on how to tackle.
Yes, on the management of performance anxiety in singers.
So how you were doing that? So what you were actually doing in this research, and how it was received, maybe by your supervisors, and yeah.
So the research. So in order to justify the research, the first thing to say, I suppose, is that there's been lots of research about performance anxiety already. And it's shown that while there are medications that can prevent you from having a panic attack, or prevent you from feeling anxious, it suggests that the passion of a performance is lost.
When you
So
get the medication.
Yeah, so you can take medication and do a technically good performance.
Yeah.
Or you can live dangerously and give a passionate performance.
What a choice, yeah.
What a choice.
Yeah.
And 50% of musicians experience significant performance anxiety. It's part of the job. You know, you need the adrenaline to give a beautiful performance. It's part of the job. But we don't support people very well to learn ways of managing this. And singers in particular, they do not like to take the medication. So there's already a space for complementary and alternative approaches, and for trainings that will help you to relax and prepare for a performance. In the same way as you might practice Alexander technique, or you might practice yoga in order to improve your awareness of your body and the flow of movement through your body, you can do a breathing technique, any conscious breathing technique, to help you to improve your awareness of your respiratory system and to feel really present and in control. I think I would say relaxed within your system. So helping musicians, helping singers in particular, to be aware that they are breathing in a shallow way that is going to potentially affect their voice before a performance, and teaching them a simple technique that they can do to slow the breath down and lengthen and deepen into the diaphragm, not only serves their support, their respiratory support for their voice, but it also will prevent them from having this big anxiety, sympathetic nervous system response. So
how you were able to show this.
So my research proposal was received with some concern,
Yeah.
partly because I was very ambitious about what I wanted to do, and I had very high expectations about the resources that were going to be available. And in truth, I had excellent support from my course and great support from the Royal College of Music, who supported me to provide a space for the research, and supported me with some of the technology that I used to do the research. But it became very clear that I was going to need to do all of the facilitation myself in order to have a consistent process throughout the whole experiment. Now, when I'm measuring the responses and I'm also delivering the technique, there's already a question about how strong the evidence can be. So we worked really carefully. I worked very carefully with a psychologist called Carol Chapman, who was my supervisor for the project, and she came to some pilot sessions and she observed the technique and observed how I practice, in order that she was able to then help me build a protocol. So to write down each step of what we do and to keep constant between each person that I worked with, to keep constant each of those elements. So, for example, having the experiment done in the same room every time, having the temperature in the room the same every time, having the music the same every time, and the volume of the music and the light in the room, because all of these things could potentially contribute to the effect of a technique. Having just me delivering it every single time also meant that it was consistent in terms of what was delivered. So we made a decision that that's how we would do it. And despite the amount of work that it would be, we talked about just testing 5 minutes of breathing, and my training is in transformational breath, and I really wanted to honor transformational breath and to test it in its entirety for this first study. So for the methodology, we controlled everything we could to keep it all the same, and then we delivered a full transformational breath session with the same facilitator and the same set of interventions that were all delivered as required in order to achieve the breathing pattern that we look for in transformational breath. Does that make sense?
Yeah.
Did I answer your question?
Yeah, the question was very general about your research, and
Yeah.
I think it's very important to be aware of what you were controlling for. And of course, there is it's just impossible to control for everything.
Yeah.
But just to be aware of.
Yeah.
And with the breathing, is a quite comprehensive approach. So you
Yes.
can control for so many things.
Yes, right?
And that to me sounds like you were doing a quite ambitious in the very reflective approach to
Yeah.
to meet like the standards of the academic community, and that
Yes.
is with such a comprehensive approach is not an easy thing to do.
No.
So you were when you were saying your approach was very ambitious, or your endeavor was very ambitious, I can see that.
Yes.
And it's very honorable and it's very admirable to do it and to face all these things.
Yeah.
So how would you describe your main findings for somebody who's facing this situation, or who is concerned about their kids having some musical training and starting to perform in public.
Sure.
What are the findings and what are the implications you would draw based on those findings for how to handle the situation?
Sure. So, shall I give a very brief context so that the findings are... I will give a very brief context. So I tested 24 professional singers with diagnosed anxiety disorder. And I also tested for depression and for well-being scores, for music performance anxiety and general anxiety. So we did lots of mental health assessment. And we measured blood pressure and heart rate and oxygen levels before and after the sessions too. So in people with diagnosed anxiety, practicing one session of transformational breath in its entirety with coaching and breathing and intention and all of the interventions as we are taught to deliver transformational breath, one session will significantly reduce the score for social anxiety, general anxiety, performance anxiety, and depression. It will significantly increase well-being, and it will significantly reduce blood pressure and heart rate. So that's one session of this technique compared to controls.
You were testing for that in terms of questionnaire, or you were measuring the people on stage and after the...
Yeah, so at this stage we were using standardized medical tools, so questionnaire tools, to measure the anxiety, depression and well-being.
Okay, before and after the session.
Before and after the session.
Okay.
And we showed that one session will give a significant improvement in these. When you look over a course of 3 sessions, we did not show a significant difference for those measures. This is likely to be because it's a very small sample and they all knew that they were going to get no more treatment, and several other factors. So there are lots of reasons to explain it, and this is a small study. But what we can say is after 3 sessions, there's a significant reduction in blood pressure and heart rate. So that's interesting because those are physiological measurements of stress, which we could investigate further looking forward. So the study is short in some ways. It's too short. It would be nice to measure them now and see how they are. And I know that several of them are still practicing, still breathing.
I was thinking, that was appearing. Was it like you're doing with them transformational breathing sessions, or did you give them like something to take home, some breathing exercises to take home in order to integrate in their daily life, or to integrate in their routines before or after performance on stage? Or
So transformational breath can be learned in a minimum of 3 one-to-one sessions with a facilitator. It can be learned in groups and it can be learned using a guided tape, but in an ideal world you would learn it with a facilitator. A facilitator is someone who will teach you one-to-one and show you how the technique works and support your process. Once you have learned how to do the technique, and even after the first session, I offered all of my participants Judith Kravitz's guided 5-minute, it's called 100 Breaths to Joy. So I gave them all this standardized CD and invited them to breathe each day, to keep their breathing open and to practice. Whether or not they did during the study is difficult to assess reliably, and so I did not measure that. But that would be interesting.
Did they do a self-assessment, or you just didn't?
No, I was already measuring many things.
Yeah, of course.
So
it's
all
follow-up study.
All research is faulted. All research teaches us something about what we need to do next. And no one project is going to give you the definitive answer about anything.
So I'm glad to hear that you're already thinking about what to do as a next step, and that sounds very enthusiastic and very promising to me.
Yeah, it would be interesting to assess whether the breathing technique on its own, without the coaching, is as effective, or whether it's the combination of the two things that works. It would be interesting to know whether the breathing technique works as well without music. There are so many questions, and we are at the beginning of a relationship between science and research and our community in the conscious breathing world, in terms of how we can see the light. In terms of how we can take this forward. And in truth, science and medicine, they are evidence-based practices, but the process of science is not very scary. It's about asking a question, setting up a test, and then interpreting what you find, without judgment. If you think about it, it's a little bit like the inquiry that we do in our breathing practice. We ask a question, we ask for insight, we breathe a little, and then we see what comes.
So we're at the beginning, and at the same time we are at the end.
Exactly.
This conversation. Thanks for sharing your work with the breathwork community. Thanks for bringing breathwork to the scientific community. And I'm looking forward to hear more about your research and to read more about your research and to your future projects.
Thank you very much for having me. The paper will be published soon, and there's definitely more details in there. And the thing I would say is that being aware of your breathing can never be a bad thing, particularly if you are someone who suffers with anxiety. Before you go into an anxiety-inducing place, before you go up to speak, before you go into the interview, before you get on the train, even if you bring your attention to your belly and take 10 breaths, it will change something for you. The empowerment that comes with this work is so beautiful.
So that is a very nice, practical recommendation. You can give and we can give to everybody from here, from the Global Inspiration Conference in Austria, going to the world. Okay, thanks for watching.